What if the pain you've been living with for years isn't normal? Hi, everyone. I'm Stephanie Simmons, and this is The Backstory. Today, we're looking at endometriosis. It's a chronic inflammatory condition that affects about 1 in 10 women of reproductive age. It can cause severe pain, impact your daily life, and even lead to infertility. It's scary. But getting a diagnosis can sometimes take between 7 to 10 years because it doesn't always show up on routine scans. We're also going to touch on PCOS, recently renamed PMOS. It's a hormonal condition that affects about 1 in 8 women worldwide, and it's also one of the leading causes of infertility. Coming up, we'll hear from a local woman about her struggles with endometriosis and her treatment plan. But first, I'd like to welcome a surgeon who specializes in these conditions, Dr. Chandra Spring-Robinson. Thank you so much for being here for this very important topic and a condition that affects so many women out there. So let's start with this. Let's get into some more detail about what exactly endometriosis is.
Okay. Thank you for having me. So endometriosis, as you said, affects 1 in 10 women. And what endometriosis is when the tissue on the inside of your lining of your uterus, tissue like it, grows in your pelvis and abdominal cavity. It can affect your ovaries, it can affect your bowel, your bladder, your diaphragm, and grows throughout those tissues.
And it's oftentimes misdiagnosed, and it can show up as soon as a woman has her period, correct?
That's correct. So for many women, it can occur in their 20s, it can occur in their 13s, and some women don't notice until they're in their 40s or when they try to become pregnant.
Because a lot of people just pass it off as, oh, this is a painful period.
So one of the most difficult things with evaluation and treatment of endometriosis is the normalization of pelvic pain. It's okay that your periods are painful. It's okay that you have to stay out of school. Your mom had to stay out of school. You have to stay out of school. This is fine. When actually it's quite abnormal. This is not okay. It needs to be treated, evaluated, and treated.
Well, you can have the symptoms of a period, but these are, you're saying, way, way worse.
Not always, but yes. So when I say not always, that some people don't even have period symptoms with endometriosis. They could have just bowel symptoms or urinary symptoms. But with the typical pains of endometriosis, you will have pain that all of a sudden gets worse and worse with each cycle. You will all of a sudden find that you are running your life around your cycle instead of your life. So instead of being like, I'm going to go do this weekend, it's I have to stay at home this weekend. I'm going to be in too much pain.
It's debilitating, and it also, there's a mental health aspect to it. I'm sure a lot of women who deal with this can be quite depressed.
And because basically it can affect your marriage, your relationships, your job. I've had patients lose their careers over it, which obviously then rolls into the mental aspects of having a disease like this.
It's quite stressful, and I'm sure a lot of patients get misdiagnosed all the time, and we just gave that scary statistic where it was 7 to 10 years. But the scariest aspect for a lot of women who want to have children is if it's not diagnosed right away, it can cause infertility.
That's correct. So there is hope. Many women do go on to have successful pregnancies and have healthy babies, but without evaluation and without treatment, it can lead to worse and more difficulties getting pregnant. So with that, the earlier you can be diagnosed, the earlier the treatment begins, the better it off is for the patient. You don't lose your career, don't hurt your relationships, you don't have mental issues like depression or anxiety, but you also won't affect your fertility.
So what about prevention? Is this something that you can completely avoid if you know about it?
Unfortunately, no. So one way of looking at it, though, is that it is genetic. So if your mom has endometriosis or family members have endometriosis, you should be seeing a GYN earlier than later to discuss with them the possibilities of you having endometriosis. If you start having painful periods, it's something to then talk to your gynecologist about. If you start having severe pain where all of a sudden your pain's getting worse with your periods, you should definitely seek an endometriosis specialist to have evaluation. So the earlier evaluated, the less severe the disease can be because there is treatment plans, surgery, medications that can help further growth of it.
Okay, so one of the other things we mentioned in the introduction is that it's oftentimes missed with routine scans. So if you go in, you're trying to do everything correctly and you're trying to get evaluated, what kind of scans are there? In 2026, has technology advanced to see it better, like a better chance of this? And what are the options for patients?
It has and it hasn't. So MRI has improved. Ultrasound has improved. But where the real improvement is us being able to see those images and now be able to recognize it. So by going to see just an ultrasound, probably you're not going to see it. But if you go get an ultrasound that has endometriosis mapping, you will be able to find it. So that's looking at how the tissues move with each other. If you are going to just get a basic MRI, who's going to be read by somebody who's not educated in endometriosis, it might get missed. But now there's more people who are recognizing endometriosis and are able to now see it.
Okay, so let me ask you this though with MRIs. So say you have a sports injury. Now that we mentioned this is a chronic inflammatory condition, so I want to focus on the inflammation part of that. If, you tear a muscle or something, you can see the inflammation on an MRI. So why is it because the endometriosis is so small?
So basically, the worse the endometriosis is, the easier it is to see it, right? So the more thicker the tissue, you can imagine with any imaging, you'll be able to see it better. But if you have very thin endometriosis, and I've seen this before where someone's MRI is normal, their ultrasound normal, but their entire pelvis is covered with endometriosis, but it's thin, we won't be able to see it. If it doesn't change the anatomy, so we don't see the ovaries not moving, then we might not see it. So there are indications, but a lot of it sometimes that brings us to the OR or treatment plan is actually the clinical still.
Okay, so where do you see it come up the most in your patients? You mentioned the pelvis. Is that
That's most common.
Okay.
I mean, honestly, so the typical symptoms of painful periods is the most typical. But I think what gets overlooked and what is now being more recognized is somebody who's basically seen multiple specialists because all they have is GI symptoms. So they've seen gastroenterologists. And then they also have some urinary symptoms, and they have a little bit of pain. They now are basically recognizing, oh, this constellation of symptoms is endometriosis. So the delay in diagnosis of 7 to 10 years can sometimes come from not women not trying to find a diagnosis, is that the symptoms are never correlated together.
They can seem like something else. Okay, let's talk really quick. We have a couple minutes here left before we have to take a break. PMOS. Okay, tell us about this condition.
So originally PCOS. PMOS is polyendocrine metabolic ovarian syndrome. And PMOS, the reason why there was a name change is because we want to focus on the entire disease. PCOS was focused on the ovaries. PMOS, we need to focus on the entire woman because it affects not just the ovaries and infertility. It's increased risk of insulin resistance and diabetes, cardiovascular disease, weight gain, facial hair growth, hair loss. So instead of looking at just a GYN or reproductive disease, it's actually an endocrine metabolic hormonal disease.
Okay, and do you oftentimes see a correlation with women who have endometriosis also have this, or they're completely separate?
Actually, I do see it. It's not all the time, but we do see that because basically we see when maybe there's endometriosis, there starts being issues with hormone metabolism, and then with the hormone metabolism, the PMOS comes in. PMOS is also thought it's possibly genetic. So when you have endometriosis and PMOS, there might be a tie there, but we do see it.
So these poor women are in horrendous pain potentially, and then if they also have PMOS on top of it, their looks could be changing as well. So you understand the mental toll it can also take.
It's a huge mental toll because basically a lot of times women with PMOS, they could be basically, as I always say, you're looking at a hamburger and all of a sudden you feel like you gained 5 pounds because you have no control of your own weight. You all of a sudden start having issues with cardiovascular, like your blood pressure starts rising, and you're eating the healthiest and working out the best you've ever did in your life. And then on top of that, you're being like the disability of having painful periods. It can be very confusing.
Yeah. All right. Well, Dr. Spring-Robinson, stay right there because coming up next, we are going to hear from a local patient about her experience with endometriosis. Stay with us. Welcome back, everybody. Joining us now is Lindsay Mirando, who's a patient of Dr. Spring-Robinson's. We'll bring the doctor back in the next block after this break. But first, we do want to hear from Lindsay and her story because, Lindsay, your road to feeling better was very long and painful. So first of all, is your endometriosis completely gone now, and how are you feeling?
I feel amazing. I'm about a year out from my second surgery with Dr. Spring-Robinson, and I feel phenomenal. So I'm just very grateful, mentally and physically. It's been a long journey, but I feel great.
You know, I just met you a few minutes ago, but I can hear the pep in your voice, and you sound very happy. So the road to recovery looks good on you, okay?
Thank you. Appreciate that.
If you can walk us through the timeline of when your symptoms started to when you decided to get help.
Yeah, for sure. I'll give you the truncated version because it's pretty long. You know, my symptoms actually started when I was 13, but I didn't know that. It was exactly what Dr. Spring-Robinson mentioned. I just thought painful periods, very long, heavy periods, being put on prescription pain meds as a kid and birth control was normal. And so I just went about that through my life. And once I hit about 35, 36, I started to experience severe bloating, weight gain unexpected, some hair loss, and I just couldn't figure out what was going on. And so I was chasing, really for me, the bloating and the weight gain. And I chased it for almost 10 years, 7 to 10 years to find a diagnosis.
So you were eating right, you were exercising, all of that, and you just really didn't see a difference.
Oh yeah, I had gotten really big into health in my late 20s. I, tried every diet, cleanse, anti-inflammatory diet. I was all about all organic, eat whole foods. I tried the timing of my foods. You name it. I went to a functional doctor, Western as well, and tried it all. And every morning I'd wake up and look bloated. Didn't matter what I ate.
So frustrating. So how many doctors did you end up seeing before you found Dr. Spring-Robinson?
I counted it. I think it was almost 10 doctors between functional doctors and MDs, and I spent over $20,000 between supplements, diets, doctors, you name it, to try to get a diagnosis.
Yeah, that's a whole other component of the road to finding answers and feeling better. I think women get to a point where they're so frustrated and they're really trying. They're not just complaining. They are trying, they are putting the work in to figure out what's going on with their bodies. And it is very costly. It is very, very costly. So I know a lot of women feel what you're saying right now. So how else, besides the financial impact that you just mentioned, did this impact your life overall?
Ooh, that's a hard one. Mentally, so much. I had severe anxiety since I was 13 years old. And it was just an everyday part of my life. I went from therapist to therapist to try to figure out, what it was. I couldn't, it just wouldn't shift. And I think at a certain point, one of the biggest things beyond the anxiety was that I stopped trusting myself. I stopped trusting, I love food experiences and going out trying new cuisines. And I stopped trusting what I put in my body. And I kept thinking, it must be me. I questioned every bite. If, a protocol didn't work, my 14-day cleanse, I thought, what, it's because I didn't eat perfect. That's my fault. So you started to blame yourself, and it just took a real mental toll. I just felt exhausted, and I felt like the problem was me, that I just couldn't figure out what it was, so it must be me, and it was exhausting.
Your road to being healthy, that journey that you started so young, it's very commendable, but we oftentimes try to live by the 80-20 rule of 20% should be crap, especially when you're in your 20s. Right. So that's really a struggle in and of itself, but it does sound like you have a good support system, and you have a husband.
Yes.
Okay. And tell me about how supportive he's been in the process as a partner for someone dealing with this.
Oh, he's been amazing. I am so grateful to him. He's just been by my side through the entire journey, supporting, telling me how wonderful I look. He was at every Dr. Spring-Robinson appointment. He wanted to see the surgery photos when I didn't want to. He was, in it, and he's just been an amazing partner that has loved me for who I am throughout the whole journey.
I think that's important for any partners out there to hear, because women, we like to look pretty. At the end of the day, we're women, we're feminine, we love that. And conditions like this can make us feel gross. Anything that affects the hormones, we feel disgusting, from the greasy hair to the bloating, as you dealt with for years. And so I love, yay, what's his name?
Danny.
Danny, yay, Danny. Yay, Danny. Okay, he deserves a dinner, okay? Danny gets a dinner. Okay, so let's talk about a sensitive part of this issue too. And I asked you beforehand if it was okay. I didn't ever want to ask anything like this live to someone, even though you told us you're an open book, and we appreciate that. The fertility issues that this kind of condition can cause. So where were you at on children before you were diagnosed?
We had already determined we didn't want children. So I do feel very fortunate that we were in that place, that we had already made that decision and we were set on it.
Okay, that's good, because a lot of women have to go through that additional component, and you already went through enough, so thank goodness you didn't have to go through that chapter. Okay, and then real quick, because you'll be joining us again after the break, so we have much more to talk about, but how did you finally find Dr. Spring-Robinson, and how did she help you?
Oh my gosh, well, how did she help me will be a whole segment. But how did I find Dr. Spring-Robinson? One of my coworkers, he started talking about his wife's journey. She had bloating all the time. We both had SIBO, which is what I was chasing. And he told me that she had seen Dr. Spring-Robinson, and she had been diagnosed with stage 4 endometriosis. And I thought, you know what? I've gotten a list of 12 to 15 diagnoses, but that's never been on there. Maybe I should go see her. Sure enough, it was the best decision of my life I've made.
Okay. Well, she's going to be back with you after the break, so stay right there because we are going to talk about treatment plans and other ways to treat the condition that was not customized for you. So there are a lot of other options for people dealing with some other symptoms as well. Stay with us, everybody. Welcome back. Lindsay and Dr. Spring-Robinson are joining us once again. We're talking about treatment for endometriosis. So, okay, doctor, we're going to start with you. What was Lindsay's treatment plan and how did you customize it for her?
So just between the pelvic exam and the imaging, which was ultrasound and MRI, we were able to see that she had endometriosis. And that's because, unfortunately, she had a long delay in evaluation and treatment. So it was very easily diagnosed. And so the first step was basically seeing what we could do with the endometriosis without removing any of the reproductive organs. So we went to surgery and evaluated. I removed all the endometriosis, but with that surgery, we then realized it had grown to be quite advanced and that we had to do a second surgery.
Oh, okay. So what does the second surgery entail?
Well, for her, basically with her life goals, her pain, and what her situation was, we did perform a hysterectomy. And for her, though, that was her best treatment plan. And I always think when people hear hysterectomy, they get really scared. They're like, oh my gosh, I'm going to have a hysterectomy. And you have to realize every patient is a different patient. Everybody's treatment plan is different. And everything has to be tailored to that patient. So for her, that was the best option.
Yes, I was telling Lindsay before the show, I have family members, all who went through this, and I called them each before we did this episode asking, well, yeah, and then it's scary because the more you learn about it, I guess I got lucky, thank goodness, but one family member had a simple procedure, and then another family member had it so bad she got a hysterectomy as well. So you run the gamut, but the first family member, she was in and out that same day. So, I guess if you catch it early, is that the best course of action there? You're less likely to need a hysterectomy?
In essence, yes.
Okay.
So basically, most endometriosis, if we can catch it early enough, we can get it stabilized.
Okay.
And basically, we can then track it, monitor, see what treatments work for that patient, and be able to delay regrowth. Some patients, I've definitely had to do surgery on a 13-year-old who was diagnosed that young with basically ovarian cysts that were endometriosis. So it can range the gamut, but most of the time, the earlier we can diagnose, the earlier we can treat, the easier the outcome and treatment is for the patient.
Okay, and Lindsay, were you scared going into the surgery?
Oh, yeah. But I will say Dr. Spring-Robinson, really what I love so much about her, she is so thorough. I understood what every step was going to look like. I understood what hormone replacement therapy was going to look like. She reassured me she would be doing that from day one. And so that helped a ton to really ease all of my fears. And I trusted her. So I knew that we were going to be in good shape. But yeah, I did have some fears around it.
That's another component of all of this. So, Lindsay, you're 43 now, and that throws you right into menopause, doesn't it? Take you a full hysterectomy?
That's correct, yes.
Which has its own battle.
It does, but as long as we know what the treatment plan and goal is, we can do it smoothly. So basically, is treating or replacing hormones on someone in their early 40s more difficult than in their 50s? Yes, you require more hormones. But it is doable. Does it take a little bit? Yeah, it can take 3 to 6 months almost sometimes to get patients' hormones stabilized to where they need to be and where they feel the best at.
But Lindsay, you weren't in as much pain anymore when you had to start the hormone replacement therapy?
You know, it's interesting. I actually didn't have a lot of pain beyond, period pain.
Oh, okay. So that's really good to hear.
Yeah. So that wasn't one of my major symptoms. So yeah, post-surgery, of course, getting through some of the healing and recovery, I'm pretty fortunate. I don't feel pain often. If I do, it's just because I, did a harder workout or something of that sort.
Good. Or you're tough, one of the two. Okay. So was Lindsay's surgery, was it robotic assisted? Because we know you do a lot of those.
Yes, it was.
Okay.
It was.
And so with the technological advancements with things like that, how much easier is that for you to do?
It's not almost ease, but it's the better treatment option because it allows me to fully remove all of the endometriosis. So basically, I'm able to see more, and I'm able to do quite precise movements. A 5-inch movement becomes a 1 centimeter movement. So I'm able to remove all the endometriosis while keeping the nerves, blood vessels, reproductive organs intact. So, and without damage. So that's how robotics has truly helped us. is that it allows us to have a more refined and better treatment plan for that patient.
Okay, so from minor cases to severe, so hysterectomy being, we don't want to go there, but we will if we have to. What are the other options for people who maybe have different symptoms than Lindsay?
So let's say the person's like, I don't want to have surgery. I'm done. I just am too scared of it. There are other things, and there can be anything from, I would say, pelvic floor therapy. Basically, there is acupuncture. There is other hormones we can give, not always birth control, because actually birth control doesn't always help. High-dose progesterone helps. There is multiple different things, and even GLP-1s we've started going into for the treatment of the inflammation for endometriosis.
How interesting. Okay.
And that does a lot. But in the end, probably the best treatment plan is surgery, because sometimes we think, oh, well, it's not that bad. But then we get in there, and it is.
Yeah, you find more because it's so small.
And that's the thing, is that if it's like, it can be on the bowel, it can grow into the bowel, it can grow into the bladder, it can grow into the diaphragm. And if the person's not having those symptoms, they might not be evaluated until it's way down the path.
All right. When we come back, we're going to have some final thoughts with Lindsay and the doctor. Stay with us. All right, really quick, Lindsay, final thoughts for anyone dealing with endometriosis.
I would just say keep advocating for yourself. There is hope out there. There are amazing doctors like Dr. Spring-Robinson who will listen. If you're in San Diego, go see her. But just don't stop giving up and believe in yourself, because you deserve answers and you will get them.
All right, and doctor, same for you, final thoughts. What's the number one question patients should be asking their doctors if they think they have endometriosis?
Are my periods normal? So basically that is the main thing, is stating, is this normal? Is this pain normal? I am coming out of school, I am not able to complete my job, and that way they can actually start the diagnosis process.
Such great advice. Ladies, thank you so much for joining us. We're out of time. I'm Stephanie Simmons, and this is The Backstory.